Lupus, dubbed the disease of 1,000 faces, is a type of autoimmune disease where the immune system attacks healthy functioning cells. Lupus comes in different forms: systemic lupus erythematosus, discoid lupus erythematosus, and drug-induced lupus. Systemic lupus erythematosus is the most severe type of lupus because it can affect the body's organs or organ systems. The symptoms can range from mild to severe. It causes butterfly-shaped rashes, which can leave scars if untreated. Discoid lupus erythematosus only affects the skin, which can be triggered by exposure to sunlight. This type of lupus does not affect the vital organs. Lastly, drug-induced lupus. This is where lupus is developed because of a reaction to a certain type of medication. This lupus can be temporary. It can go away if the medication is stopped.
The disease results in a diverse symptoms that includes arthritis, anemia, and kidney and central nervous system damage. These symptoms ranges from mild to severe depending on the body's immune system. The most visible signs are fatigue, fever, joint pain, butterfly-shaped rashes, photosensitivity, shortness of breath, chest pains, dry eyes, headache, and inflammations. 14.
Inflammations caused by lupus affects the lungs, heart, central nervous system, and kidneys. Inflammation in the lungs occurs when the fluid between the lungs and chest wall leaks out, causing painful breathing, pulmonary embolism, and pulmonary hemorrhage. Kidneys. Inflammation in kidneys causes lupus nephritis and blood in the urine that leads to its damage and failure. Lupus affects the brain and central nervous system by causing memory problems, cognitive dysfunction, emotion disorder, behavioral change, being confused, and unable to focus. The inflammation of heart that caused by lupus includes pericarditis, which is the inflammation of heart membrane, endocarditis, and myocarditis. However, myocarditis can be caused by viral, bacterial, and fungal infections.
The causes are mostly unknown and some potential triggers include sunlight, infections, and medications. The causes of lupus are unknown, however, scientists believe that hereditary and environmental factors are some main causes, such as sunlight when exposed. It could result with lupus kidney lesions or might trigger an internal response. Lupus can be triggered by a certain type of blood pressure medications, anti-seizure medications, and antibiotics. Infections also initiates lupus or causes a relapse where the body has a weak interaction with the bacterial infection. The risk factors of lupus occur more in women than men and is likely to target all ages, but mostly ages between 15 to 45. It is most common to African American, Hispanics, and Asian Americans.
There are four main treatments for lupus: non-steroidal anti-inflammatory drugs, corticosteroids, immunosuppressants, and biologics. Non-steroidal anti-inflammatory drugs can be used to treat pain, swelling, and fever linked with lupus. Corticosteroids are used to control the disease when it is involved with kidneys and brain. Immunosuppressants are also used. This suppresses the immune system, which can be helpful in serious cases of lupus. And lastly, biologics, which only reduces some symptoms with only mild side effects such as diarrhea and nausea. Biotechnology is applied to the study of anti-C1q antibody concentrations by ELISA in systemic lupus erythematosus. In a study done by Marjorie Muir, Weatherall and Company, a solid-phase ELISA kit was used to quantify immunoglobulin G alpha C1q absorbance. At the end, the results indicated that anti-C1q antibody concentrations is related to systemic lupus erythematosus patients with dsDNA absorbance concentrations and contrarily with complement C4 concentrations.